simple of an explanation.
There's more and more studies coming out in countries around the world, like in Iran, where there was an embargo of pharmaceuticals from the US. Right now, Iran is actually coming out with a lot of double blind studies on herbal medicine because they're kind of stuck. They really need to help their masses get better. So we slowly but surely are getting more studies that make Americans feel better. It makes
Yeah.
American feel better.
I would imagine
But
that
let's
most people, and it kind of reminds me of, the vein that you're going down is that there's not a blanket treatment for every single issue that you could ever have. You've got to treat the individual. I really like that. It reminds me of the conversation that Sean and I had on the podcast with Dr. Emily Oster, who did, if you're not familiar with her work, she did a lot of research in determining what techniques, I guess, and what decisions parents need to make when they're raising infants or when a woman is pregnant, when they're raising toddlers, what things work and what things don't, because there's a lot of noise out there, and every single person who's ever been pregnant, given birth, raised a child has an opinion on what is best. Should you breastfeed or not, or should you, swaddle your child or not? There's so many different things, and she kind of parsed through the data, and essentially one of her overarching conclusions was that you can't just accept every single rule of thumb. Rules of thumb are good in helping you determine direction, but to make a decision, we've got to really parse through the data and make a decision for each topic. And that's not the answer that we want to hear. We want to hear that there's a guidebook, that there's black and white rules for everything that I would ever want, that I can just look up an Excel spreadsheet and lick my finger, thumb down through the list to find in alphabetical order the particular issue that I'm being faced with in this moment. And bam, right there's the answer. The reality is there's a myriad of variables that come in, whether we're talking about a health issue, a parenting decision, whatever it is. It seems to me like a big problem that we have in seeking or finding the best treatment option is something that you mentioned earlier, right? Your doctor spends, 6 minutes with you, and that's it. And because of that, they are forced to kind of put you into a box and say, okay, well, you have this issue, therefore, bam. And I think that's why you're seeing the rise in, I'm sure there's a more accurate, a more widely adopted name, but I call him the country club doctor. You're paying for like an annual membership to go to a physician who's going to be able to spend more time with you and be able to craft more personalized advice and solutions. And I think that that's good. I'm struggling to see what the solution is for people that either don't have the ability themselves, whether they don't have the time, they don't have the knowledge, they don't have access to insight and expertise to be able to get that personalized advice. Or maybe they just can't afford it. What are those people doing short of becoming a homeopathic expert and, an herbalist themselves?
I'm so glad you asked that. So I happen to be an international board certified lactation consultant, and I've helped over 35,000 babies breastfeed. And I guest lecture at medical schools and medical conferences across the US. So I'm trained in conventional breastfeeding medicine. So I spend an hour and a half with each client. So there's a certain amount of fluid each baby needs to take in at their weight and their age. And there's a certain technique that's going to work for almost 99% of babies in order to coordinate suck, swallow, breathe. So I'm proficient in that, Sanger. I know exactly how much the baby needs, how to train a baby to coordinate suck, swallow, breathe, and I'm actually an expert in that. But where I differ is that I spend an hour and a half with each baby. And I know whether this baby has reflux, this baby's having some digestive issues, this baby's a little stubborn, this baby's a little aggressive, this baby's a little passive. The mother, maybe not so coordinated, maybe not so smart, maybe brilliant, maybe wants to ask 100 million questions. So I have this medical foundation, and then we individualize it for who they are, what they can do, what their strengths and weaknesses are. So going back to your other question, I wanted to say that so there I have that medical foundation with understanding that each mother baby dyad is going to be unique, and I have to formulate a plan that's going to work within their lifestyle. Are they a city slicker? Are they out in the country? Are they on a farm, right? Are they in a village? Perfect. So next question about what if you don't have the time? What if you don't have the finances? So that's one of the reasons I wrote my book, Mootopia. My book, Mootopia, is a book about the benefit of herbal medicine for emotional challenges. And what I did was I went plant by plant with describing what family it's from, how you use it as an individual herb. Is it for frustration, anxiety, depression, gloominess, right? So there are a lot of resources out there to help people that are struggling. Now, why did I write this book? Because I had a lot of women and men that were on Klonopin, Zoloft, Wellbutrin, diagnosed with emotional challenges, and they just weren't getting better from the medicines. Sanger and Sean. They just weren't. I mean, got out of bed, they weren't depressed anymore, but they weren't enjoying life as much. And I saw after many, many years that when they included botanical medicine in their life, in even tea form, like just making a cup of tea from rose petals. Roses are all edible. I wouldn't eat them from your florist, but they're edible. And roses are for people that feel like they have a broken heart. So especially in our life right now of chaos, right? People lose their jobs, relationships crumbled after people lived together, in isolation for a year. Other relationships thrive. So if you feel like you're going through a broken heart, the knowledge of including 1 or 2 cups of rose tea into your life is not against the conventional medicine, but can be in addition to someone's life. So what I want to say is everybody should find 1 or 2 people who they research, see that they're well educated, and follow the books that they write, or like I'm on Instagram, you can follow me on Instagram. And if you like their outlook, then you can include that in your life, because I agree with you. Not everybody can afford to go to an herbalist, but back to decisions. If you decide that the medical care you're getting is not up to par, you don't feel you're being treated like an individual, you don't feel like you're being listened to, a decision may be to spend money with an herbalist. And our whole goal is to empower the individual to know the botanical medicines, the botanical plants that seem to fit their makeup. Are they dry? Are they very moist? Do they get sinus infections? Do they get urinary tract infections? Do they have lower back pain? Do they have joint pain? And once you learn a couple botanical medicines, plants you can bring into your life, they're yours for the rest of your life. So I'm actually in the decision making. I'm going to empower someone to have a couple choices that they can grow in their backyard or on their windowsill.
Yeah, I love that. The last time I went to a doctor, I had a sore throat. It was bothering me for like 3 or 4 days. And everybody I talked to on the phone said, don't call me back until you go to the doctor. I said, oh, okay, fine, whatever. I really didn't want to go.
That's pretty bad.
So, I just went to the urgent care down the road, and I walked in after I was there 20 minutes before they opened, but I still had to wait 30 minutes to see a doctor. Then the nurse comes in and, she does my blood pressure, all this, asks me a few questions. Then, another 30 minutes later, the doctor comes in and he goes, okay, let me see your throat. Okay. Yeah. No, it looks like strep. It's probably not COVID, or it doesn't look like strep. It's probably not COVID. It's probably just some, other bacteria, probably laryngitis. And he goes, but do you want to test for strep? And I go, I don't know. I don't have any of the information. I don't know what the pros and cons are of my answer to that question you just asked. I go, what are the risks of me having strep? And like, what would happen if I had it and we didn't test? Oh, well, then that would mean that the prescription that I give you today wouldn't work, wouldn't do anything. I go, huh, okay. Well, does it cost me any money to test for strep? No, it's free. Well, how long does it take to get the results? Like 5 minutes. Is it painful? No. Well, it seems like you could have just answered this for me. There's no downside to this. Okay, yeah.
Make decisions.
Yeah, just then how about you just do that? And then he goes, okay, well, do you want to test for COVID? And I go, why? Like, again, same questions, right? What would you do differently if I was positive for COVID? Oh, nothing. Okay. Then no, I guess. And then he goes, okay, well, we'll give you a shot, right? I go, okay, what's the shot? And he goes, it's like a steroid shot. It'll help you, get better. And so I said, well, all right, fine. They go bring in the nurse. The nurse gets the steroid. She comes in. She goes, hey, do you ever like pass out when you get shots? And I said, well, no one's ever asked me that, and that's probably why I've passed out so many times. But yeah, I have passed out before. And she goes, oh, well then do you want to just do the pill? And I go, there's a pill option? and I go, well, I guess, but what, again, for the third time, what are the pros and cons here? And she goes, well, it's just like, it's the same thing, but it's a shot or a pill. I go, that can't be the only difference. What's the cost difference? Oh, I think they're pretty much the same. Maybe the pill's a little cheaper. I go, okay, so, score one for the pill. I said, was there a big delay in how long it takes for them to work? And she goes, well, the shot will start working in 30 minutes and the pill will start working in 2 hours. And I go, okay, so basically no. What do we do? Like, give me the info. But instead, I had to ask every single follow-up question. And it was so frustrating. And I don't know how much of it is because they aren't able to build a relationship with their patients. And so, if you're doing that all day long, you kind of have to just leave. I don't know. I mean, I guess some of it can be
like one of the upsides when we look at herbal remedies. It would seem like one of the upsides is that very few of those are going to have specific negative effects to that. So why not try it, right? How many times do you come across where there are negative effects? I mean, obviously, if I'm going to eat, roses, like you said, I guess maybe there's not a lot of negative effects to eating some of these things that are in the menu that you would offer. I mean, clearly there are negative effects if I just walk out in the woods and start, grabbing things and eating them. That could go south pretty quickly. But my guess is the offering that you're going to pull from, the menu that you're going to show me, is not going to have any negative impacts for somebody for treating something like high cholesterol with some herb. That's not going to screw up my eyesight or something. I wouldn't think. Are there things like that, or am I missing it?
No, I got it. And Sanger, did you ever find out whether you had strep or not?
I didn't, thankfully. I had laryngitis. I still don't know what that even means, but I took the pill and I was fine. What do you mean
you don't know what having laryngitis means? It means you had laryngitis.
Well, because somebody asked me and they said, what do you have? Like, you have a sniffle, and these days and people will run out of the room, right? So I was getting that question like, oh, you don't have COVID, do you? I said, no, man, I have laryngitis. And they go, what's that? And I said, like a throat infection, I think.
Wait, somebody didn't know what laryngitis was? Who are you talking
I didn't.
To, a third grader? You don't know what laryngitis?
What is it? Okay, what is it?
It's a thing that you get in your throat.
Yeah, so
It's
shut
a
up.
virus
You don't
in
know.
your throat
You've just heard the word.
that
You don't know
causes
anything.
inflammation, that causes your vocal cords to get inflamed, and that's
I
why
think
you
it's cool.
can't
I
talk.
think it's
I'm not a
nice that you
doctor.
figured out how to use Google right now.
I'm not a doctor, but
You
I
just